everyone. I'm Steve here with Dr. Nario. Thanks for being here, Doctor.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right, so Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check them out online and see what kind of treatments they do, some really cool treatments, and all the things that they treat. So we're going to talk about one of my favorite topics, peptides. We're going to get into 3 different types that I'll let you tell us about in a second. But peptides are amino acid chains, short chains of amino acids. And they do a lot of things in the body. There's a lot of exciting peptides, in my opinion. And so we're going to talk about 3. First, tell us, Doctor, what 3 are we talking about? And what it sounds like before we turn the recording on that these are all similar. They do kind of similar things, but they're different. Is that right?
That is correct, Steve.
Okay, what are they?
So these are the thymus peptides, as we call it, called thymosin alpha 1, thymulin, and thymogen. So even you just hearing the name kind of confuses you already. Like, what? They're all sounding the same. They are the same, but they have different specialties in terms of what they do or characteristics. And this is, again, coming from the organ called the thymus gland, which actually is something that we have at birth. And it actually increases when we're getting into that age of 5 to 10 years old. But when we reach adolescence, it will now start to fall in terms of functioning. And at the lowest function, usually around 35 years old. And it's just a steady release of these peptides when you reach 80 years old. So meaning it's not at its peak on where we're at right now. That's why we're talking about these boosters, so we can actually have this immune function, hopefully back again, not comparable to before, but again, building that fortress or that barrier for our infection protection.
So tell our listeners, where is the thymus gland?
Thymus gland is actually around the chest area, really, and it's actually related to a lot of maturation of our immune system, meaning that's where the T cells, it's their home. It's like when you want to find solace and you want to rest and grow, that's where it happens most of the time. So it actually is the one that cultivates the growth of the immune system and develops it. So you would now see that there's a lot of immune problems as we get older because of this organ not functioning the same as before.
So that's why it's important to help us keep our immune system strong.
Mm-hmm. That is
Okay,
correct.
so what is the first peptide? Tell us what that one is again and how it works.
Right. So the most famous one let's talk about would be thymosin alpha 1. So thymosin alpha 1, this is, you've heard of this during COVID. And then it got eradicated because it was actually claimed by doctors to actually cure COVID. So that's why it's going to be really hard to get this here in the US, but in the other countries, it's available. Right now, it's something that they're using as one of the main, treaters for hepatitis, for example, hepatitis B and C, HIV, even cancer. Also, when you see a non-small cell lung cancer, liver cancer, melanomas, even for chemotherapies, adjunct therapy, like it comes along with chemotherapy. And then also you talk about people who does not respond to vaccines. It actually enhances their response to creating the antibodies. And this is something that the pharmaceutical world is now trying to reap the benefits from. They're now putting a name on it, and it's Zydaxin, or Zydaxin or Xifaxin. I just kind of slipped my head there, but they're developing now this in clinical trials so that it can actually be made into as a pharmaceutical drug. So as you can see, they're also recognizing the beauty of integrative medicine now, and this is currently under phase 3 trials, I think. And China is actually using this currently in the more than the U.S. But it also, as I mentioned to you, it's good for patients who has liver failure, kidney failure, and it still will be useful. It's not like when you have these conditions, you're kind of like, it's not safe for you to use this one. This is something that can be used on these situations. And again, boosting that immune system. HIV patients, for example, benefits from this to increase their protection from their viral load of the HIV virus. And a lot of course, um, a lot of what we call bone marrow stimulation to create new blood cells and antioxidants and anti-aging properties. That's why this is something that I have used before. Now it's definitely harder to get, but it's kind of like the standard out of all the thymus peptides that I'm mentioning. It's like on top of the hill.
Okay, so you mentioned that it's not going to harm the liver, right? So it's not for the liver, but it's not going to harm it. That's right.
No, yeah, there are a lot of medications that you would tell patients that you can't take it because your liver is looking bad, right? But in this situation, when you talk about thymosin alpha 1, it actually you would expect the increase of liver enzymes even twice sometimes, just because it also goes in there to stimulate the immune cells of of the the liver. They're called Kupffer cells, and it actually increases their ability to fight and hold off infection. So, but again, it can increase, but it will go down eventually. So, safe, pretty safe.
That makes sense. So, how's it administered? Is this an oral tablet, or how is it taken?
So right now it's injectable. That's definitely something that is sub Q, as we call it. And and here's the thing: you're administering it not every day though, because again, you don't want that overstimulation of the immune system. You take it every 3 days, for example, or sometimes for like every 2 weeks or 3 months. Not, but it's not like an everyday thing that you will boost that immune system and, of course, overstimulate it. That's how powerful this peptide is.
Right. Okay, so insulin needle.
Insulin needle, yeah, you can definitely use that.
Okay, what's the second one?
So the second one is called Thymulin. So Thymulin is another thymus peptide that we use, and it has all the properties of thymosin alpha 1, but in a lower scale, meaning it's not as strong to stimulate that immune system for like the when you treat HIV or cancer. It's really just more of modulating it. So, for example, people who has like chronic conditions such as like RA, right, rheumatoid arthritis, or lupus. So these are smoldering or lingering inflammation in the body that is not as drastic as cancer or HIV infections. And in this case, the specialty of this peptide, it's actually related to lowering down inflammation. It has the more prominent anti-inflammatory property compared to thymosin alpha 1. And another one to keep an eye out for this is it's using a lot of zinc. So I don't know if you remember in COVID that zinc was a big thing to make you hydroxychloroquine work because right it's being it's like a transporter. In this situation, it's doing the same thing. So before using Thymulin, you have to make sure you check your RBC levels or red blood cell levels here. That's why it's really good to make sure you also supplement the patients with zinc at the same time. And of course, another thing here, it's also known for really if you have brain inflammation, this is also something good to deal with. And a lot of that would be TBIs, for example, mold inflammation, and that's why, as I mentioned to you, they're all looking the same, but they have different specialties. For this guy, inflammation and brain would be the specific specialty roles of thymulin.
Okay, so that's where you would use this one as opposed to the first one would be for the brain and inflammation.
Right. That's right. And it's also an injectable form as well.
Okay. So you could use that insulin needle again.
Mm-hmm.
What's the third one?
The third one is actually called Thymogen. So Thymogen is synthetic. So this is not something that, of course, the peptides that we use are synthetic, but thymosin alpha 1 and thymulin are actually created by your thymus gland. Thymogen is not. This is something that is synthetically made and copies the ones that I just mentioned. And this one is also used to regulate the immune system, but again, now on a lower scale. So this is kind of on the lowest rung of the thymus peptides, because this is, again, something that you created in a lab. It doesn't mean it's powerful, right? But that's why it's really more common to use it. For example, somebody has the flu, or somebody has bronchitis right now, the influenza condition, or the virus. So you would see how the easier, milder infections, you use this, the Thymogen a little bit more. And again, it's not bad to use this at the same time as using the other guys. But if you have something that you want at hand, this is the one that's the quick one, because it's not injectable. You can actually take this orally, and the oral form has been tested that to be effective in that aspect. So it's like a first aid, right? When you have an infection, you go for this one. So, but again, other ways or modalities to use this, it could still be an injectable form, and it also can be a nasal spray. So all of these have immune function benefiting properties.
Very interesting. So these are peptides, everyone, and they're it, the purpose of each one of these is to have a positive effect on the immune system, right?
That's right. And you have to remember how it's making waves right now in the industry, as I mentioned to you, for the reason that, like, for example, Thymogen is widely used in Russia and Eastern Europe. I don't know why we're not using it here. We are. There are some supplement companies out there that's using it, but for them, it's like buying candy in the store. So it's just right there. And for thymosin alpha 1, as I mentioned to you, FDA had approved this for the treatment of hepatitis B and cancer. So again, still in development of the phases of trials, but as you can see, it's getting there. And Thymulin, this is the one that's actually in the process of the clinical, experiments.
So these have to be prescribed.
Yes, well, the only one that you need to prescribe is actually thymosin alpha 1 when it was available. But the other Thymogen, you can get that. You can get that also. As I mentioned to you, there's some supplement companies that does that. And then Thymulin, when it was available, it needs a prescription too.
Okay. And you said there was other countries where you can just get it in the supplement form.
Yes, and here in the States, there's some you can search for Thymogen. It's out there. Of course, we're just not endorsing anything.
Okay. All right, doctor. There's a peptide for everything. And peptides, I mean, I know there's hundreds, thousands of them, a chain of amino acids. So any last thoughts on these particular peptides?
Right. So for our audience, don't get confused. I've heard patients that they're all the same. Just use one and you're going to get the same effect. You are correct. These are all thymus-based peptides, but they have different little tweaks and specialties within them. So just to make sure that I guide everyone through this, Thymogen, you can use, this is on the lowest rung. This is the oral one. You could use this for general immune support or the common respiratory infections that we get. Thymulin, this is the one that's dependent on zinc. So that's why you always want to have zinc, and you want to check it before using it because it depletes that. And it can be used in chronic inflammation, such as rheumatoid arthritis, lupus, or any other type of infection that's been there for more than, let's say, a month or two. And then thymosin alpha 1, this is the big gun, really. This is actually the stronger immunostimulant, and it's now being used for viral, even hepatitis and HIV, and even cancer support, as FDA has been looking at this right now. So don't get confused.
Yeah, no, thank you for clarifying those three there at the end. I mean, you gave us a breakdown of each one, but then it really helped, I think, for everyone to hear the clarification of the three and the similarities. So Very good information. Dr. Nario, we thank you as always, and thank you for being with us.
Well, thank you, Steve, again for having me. As we all know that our knowledge is your power to better health. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.